and we've got a very important speaker I'd like to introduce, and he can take over for us. I mean, most respected in our sport. Would you please welcome Mr. John Newell.
Well, industry seminars such as this in these sort of negative times are fairly important, so thank you all for taking the time to attend today. It's very important that there is interest and support over a range of topics that we're seeing today. Chris will just bring this up in a moment, but I thought I'd, in the limited time I have, go through a system of analysing your dog's performance, and it's a step-by-step process looking for conditions that may exist, and if you miss one of those steps you may well miss a vital condition that is limiting your dog's performance. Also, we have a number of very significant injuries that we can highlight that affect performance quite extensively, and these sort of injuries are often overlooked by our sort of regular checkers and even some veterinarians. So I'll just wait a minute till Chris gets this happening and we'll move forward. Yeah, I'm getting fairly old. I've been doing greyhound industry for probably 36 years now. Started 79 back in the old Beaumont Park days on the grass track. Developed an interest in greyhounds and have been all over the world as a result. I've spoken at the North American Veterinary Conference twice by invitation, as well as the Old World Greyhound Racing Federation Conference, and set up greyhound racing in Vietnam and now doing a lot of work in China. So we can just press up the top slideshow play. Right, we'll start. I'm often sent this sort of image from animal activists as a result of greyhounds breaking their legs during running, but I assure you that that is completely normal. And it just shows you how much stress there is on the distal accessory carpal ligaments, the ones under the stopper bone here, and on the actual flexor tendons. So it's pleasing, having worked probably for the last 5 years for greyhound racing New South Wales, the tracks I mainly work at, our injury rates for major injuries are probably 50% of what they were when I started. And that's probably a more direct result of increased knowledge of proper track maintenance. If you put the spring in the track, it absorbs the concussion that you're seeing here. And safer tracks are so important at minimising major injuries. The sort of things by safer tracks is deep watering several days before. Then it's just a top-up on race day. There's no point preparing a track on the morning of race day. And once we've got this message through to curators, and Bill Wilson's doing a great job of perpetuating this, the injury rates have certainly reduced over the time I've been with Greyhound Racing New South Wales. So just moving forward there, we'll look at checking your greyhound and looking at essential observation skills, because checking your greyhound isn't just feeling for muscles and bone problems. So symmetry is a very important thing. The good thing about a greyhound, it's got two sides, so you just compare one side to the other. You stand over the dog and you look, see if there's any swelling or any differential. You look at the balance of the pelvic bones. Look for symmetry, look for one side to the other. The next point is standing. There's a lot of ways of assessing your greyhound without actually touching it. I spoke at a conference in the US at Auburn University some years ago, and they had a $20,000 pressure plate machine. It had 4 pressure plates and a computer software. The dog stood on those pressure plates, and it would record the amount of weight distributed by each leg. For example, the left hind leg might be 70% and the right hind leg 30%. you don't need to invest in that sort of equipment. You just use your eyes, observation, dog standing on a firm surface, and that way you might get an indication it's standing off one leg. There may be something wrong with that leg that it's not bearing equitable weight on. As it turned out, the vet from Australia was probably better at finding the injury that was causing the dog to stand unbalanced. But look at your dog, just standing gives you an idea. It's very important to know the normal walking and galloping action to identify the abnormal. And in this regard, we'll have a look at the next point there. So walking. Walking on a firm surface. The head goes up as the sore leg touches the ground. If you've got a dog with a sore leg, particularly a foreign body or something in the foot, the head will go up as the sore leg touches the ground. The head goes down when the good leg touches the ground, if you've got a foreleg lameness. With a hind leg lameness, the hip on the sore side goes up as the foot touches the ground. So, simple little rules. If you learn these, just by watching your dog stand and walk, you can discover a fair bit of information. Point 4 we'll move on to is another click away. Galloping up a straight. I learn a lot from a dog galloping up a straight. When I'm working at the gardens, for example, I stand at the 500 boxes, and when those dogs gallop away from me, I'm 90% sure of what injury those dogs have got just by watching them. So when a dog gallops, it leads with the left front leg, and most of the drive comes from the left hind leg. An injury to the right hind leg makes the greyhound drift to the right. So if the right hind leg is injured, the greyhound will drift to the right, it won't run straight. Injury to the left hind leg causes the greyhound to change stride, switching its drive from side to side. A swinging hind leg indicates either a groin injury on the opposite leg or a hip or gracilis tear on the same side. And why that happens, you see the dog swinging its hind leg, it's paddling quite badly. That's to keep the greyhound balanced. If it's got a groin tear on the near side, it cannot extend that leg properly. It only partly extends it. So it has to balance and swing the other leg to keep the balance. If it didn't do that, it would fall over. So often with deep groin injuries, it's the other side. You might think the swinging leg lameness is the actual cause and the side that's affected, but it's only a balancing compensation that's occurring. If you've got a severe gracilis or drop back muscle from the bottom, it will swing the leg that the gracilis tear is on. So, and they're quite obvious. They tail off a lot more than a dog that's got a deep groin injury. Injury to the left front leg will cause the greyhound to gallop with the head towards the rail. So left front leg, they gallop with their head towards the rail. Injury to the right front leg will cause the greyhound to gallop with the head away from the rail. Simple rules, but very important rules that you can analyse your dog's performance just by looking. You haven't touched the greyhound yet. With circle running, the normal action is leading with the left front leg, then the right front leg, the right hind leg, and the left hind leg. That's the rhythm of galloping. As the greyhound approaches the corner, the right front leg, left hind leg, and then a big push with the right hind leg. The normal galloping of action. Watch the rhythm and observe. Clocking and sectional timing. Of course, you're all very aware of sectional timing. I've had a few vets here from the UK and Ireland, and they rarely concentrate on the importance of sectional timing like we do here. Accurate checking is essential for assessing the ability, fitness, and alerting to sectional problems. So if we go to the next page, we'll have a look at a little bit of sectional timing in more detail. This is the greyhound track I was involved in building in Vietnam. It's inside the horse race track in District 10. No track like it in the world. It was actually 17 metres wide at the starting boxes here. Starting boxes were full stainless steel and they were 10 boxes wide. The Asians wanted 10 dogs in a race, so we had to build a track to accommodate, and that led to massive pools when you look at the different betting combinations when you're running 10 dogs. And unfortunately it only ran for a short time. After 1.2 million US spent, they decided to build high-rise on it, but that's what happens in communist countries. Anyway, slow to the first mark, and other times are the same. Dogs missing the jump, which is a behavioural thing, or an injury affecting acceleration. Slow from the first mark to the second mark is often a toe, metacarpal, or wrist injury, most likely. These are most likely events of injury. It's not, there's a lot of overlap with this, and we used to use 4 sectional timings on this large track in Vietnam. From the second mark to the third mark, injury to the right hind leg, wrist or shoulder is most likely. And then from the first mark to the finish, simply loss of stamina, cramping, or an injury that occurred during the run. You can't be specific at that stage, but other sections you can be a bit more specific in what is most likely. Loss of time on all sections, particularly the bends, injury to right hind leg, metacarpals, wrist or shoulder. Again, not specific, but a range of things you'd look for first, if that's where your sectional timing was low. Next point, loss of time on all sections, particularly the straights, is commonly a left hind leg injury. Right, we've done a lot. Injury, cause and effects. We haven't even touched our dog yet. We've seen it stand, we've seen it walk, we've looked at some times. And the next point there, why does injury occur? Well, you can see the dog in the 8th row, no feet on the ground, total imbalance. Photo thanks to Steve Wayland at Maitland. Sometimes immature dogs and experienced dogs. Young dogs don't have much track sense quite often. Track surface and maintenance is very important. If the track dries out, you'll do hocks. I've seen it for the last 30-something years. Fitness and conditioning, and rail versus wide runners. And I sort of throw it out there for your opinion. I'm really in favour of, if your dog's a railer, you should be able to nominate that on your form. It would reduce the amount of interference in races. I mean, in an 8-dog field, everyone can't be satisfied, but if I saw dogs just there last night at Maitland that come out of the 4-box, next thing it's out there, and it's knocked over 3 dogs in doing so. So the point about rail versus wide runners and being able to nominate to minimise and maximise your chances of success, I have no issue with at all. So, many injuries that seriously affect performance are simply overlooked. Oh, back again. Back quite a few. Oh no, keep going back. Yeah, basically, if you don't look, you won't find. And that's the most important thing when we're looking at a thorough examination. If you don't look for the pectineus or you don't look for the deep groin, you won't find it. So you've got to be thorough in what you do. Okay, next page. How best to check your greyhound? I don't like ever checking a greyhound on a table. Most tables are wobbly and rickety. It's got to be relaxed and standing at rest on a non-slippery surface, and I use a roller stool to move around the dog. It's much better for you, much better for your back. So a simple, relaxed way of getting the best information from your dog. So always have a regular routine, starting at the left or right shoulder. Having a routine ensures that you've got less unfound injuries. How hard do you press? The pressure applied should cause blanching of your thumbnail and that blanching should only last for 1 to 2 seconds. Don't press too hard, and press with the flat of your finger. Don't use the tip of your finger. Palpate your muscle bellies and apply pressure to all bones as you move down the leg. If in doubt, again, dogs have two sides. Compare one to the other. If you find your dog's reacting, don't dwell on it, because you don't know if that's an area that the dog's being sooky. Go back to it, go to the other side. Don't focus on one area where you get a reaction. Be aware of the sooky and stoic dogs. Some dogs won't show you much at all, and you've really got to observe the behaviour and the attitude of the face, the head movement and the lip curl. Apologies, this isn't a greyhound, but it enables me to show you your muscles and things quite well. Just click on. I'll just go through some of the common muscle injuries that are often overlooked. I've had the sternocephalicus is a strap muscle that runs from the base of the skull down to inside the shoulder. I've had 3 ruptured sternocephalicus injuries in the last 4 months, and each of these dogs had collided with the rail. Not a mark on the skin, no wound, no nothing, but when you palpate it, this muscle was actually cut in half. 2 of them at Maitland and 1 at the Garden. So don't forget to feel the sternocephalicus, the strap muscle. We won't go through every muscle on the dog. We don't have time to do that in what we're looking at here. I'm just starting to highlight some of the injuries that I find fairly significant. Between the bellies of the triceps and the biceps brachii here, there's a groove. Feel that on your dogs, and that groove should only be fairly subtle. It's just a normal space between the 2 muscles. A lot of dogs get a widening in that groove and will get scar tissue. It's a chronic injury. If you don't pick it up initially, it'll just keep getting worse, and the scar tissue will build up trying to stabilise that groove. So the groove in the triceps you've really got to feel for. Also up the top, the rhomboideus muscle lies beneath the superficial trapezius here. So you stand over the dog and put your thumb pressure down between the shoulder blades basically, and often you'll get a reaction, one side, sometimes both, and that's related to some injury. It's a nerve pinch here, and it's often related to the wrist. When you flex the wrist, you'll get a reaction, but often the wrist isn't the problem. The problem is some nerve entrapment on the top of the rhomboideus muscle here. So the 2 are related. If you find that sort of injury, then you go down, you flex the wrist, you might find some pain on flexion, but the primary injury is most likely coming from up here as a referred pain down to the wrist. Another common one that I see, well I won't say common, but 1 or 2 a month sometimes, is your rectus abdominis, the belly muscle where it attaches right back into the front of the pelvic saddle there. If your dog has tailed off, hasn't seemed to extend, and you can't find anything else, then have a good feel of the rectus. Some area of the dog is often fairly sensitive with the rectus, so you've got to feel gently, but these belly muscle tears will cause them to tail off 30, 40 lengths sometimes, and there's nothing found on the rest of the appendicular skeleton. Go in underneath and feel that belly muscle attachment. Another one that will cause your dog not to jump very well is the tail base ligament. This is often an injury that you can see just by looking at your dog. You stand and look at the back area and look for asymmetry. Sometimes on one side, that little muscle called the coccygeus muscle, it may be swollen. It may be a third bigger than the other side, and that should alert you to the fact that there may be an injury in this tail base ligament. If they get sore there, they will not jump. They'll come out and they'll build up to speed, and patterns of running are often associated with certain injuries. But the tail-based ligament, if your dog suddenly stops jumping, is the first thing you go and look for. Treatments for all of these, we'll mention some of those later. That's an area that I often needle with a short-acting cortisone. But when we've got swabbing difficulties these days and change withdrawal times, there's a number of positive swabs currently where short-acting cortisone was needled into track legs, which older trainers have done for decades, and now they've got positive swabs. And we have not got any information from Greyhound Racing New South Wales on the withdrawal time, so I can't tell you how long to give it. It would be at least 2, maybe 3 weeks, even with short-acting cortisones like boron. But machine sensitivity and the level of tolerance of these drugs is now much different to what it used to be, and they're taking action against people when we can't even find out some guide as to dose and time of withdrawal. People would be happy, I'm sure, to comply if they knew, but I don't even know. So that's something that needs to be addressed. The biceps femoris, sometimes on the outside bottom, just above the knee there. Again, symmetry, look at it. One side may be a little bit puffier than the other. And when you put your thumb gently in there, the dog will be quite sore. Loses its drive when it's got a strained biceps femoris muscle just above the knee. And that's an injury that I'd never needle. That's one that you just work on with physical therapy, machining and rubbing out and lead exercise for probably at least 10 to 14 days. Okay, Achilles tendon junction. At times we see thickening and pulling of the Achilles tendon off the tuber calcaneus here, but the actual join between the tendinous part and the muscular part here is where the weakest point is, where the muscle is becoming a tendon. And make sure you feel the thickening. Again, one side to the other, left leg to right leg. Feel for any thickening at that point where the tendon transgresses into the muscular part of that upper hamstring. That's a common area where you'll get slow loss of performance, and you won't see it like an acute injury with swelling generally. It's a slow remodelling and thickening process and loss of form associated with that. So we'll go a little bit deeper and have a look at some of the common bony areas that are important. First one there, Chris, I think the shoulder. Ligaments inside the shoulder, they get a lot of stress, particularly on the near side or railing side. It's an area that you've specifically got a feel for. You don't normally see any thickening or swelling. Put your fingers inside the shoulder joint and put pressure on that area as you extend the leg forward. So inside shoulder ligaments are things to check for on circle tracks. Next thing, which is a very common sort of injury, is the lateral elbow ligaments. It's a common injury I find from dogs going around the gardens. You're talking usually about younger dogs, maidens through to first starters. You'll find when you press with your thumb on that lateral area just below what's called the condyle, the most prominent part of the elbow, about a thumb's width below that condyle, sometimes you'll get a very acute painful reaction. This is tearing of the ligaments that are associated with muscular attachment there. Some vets refer to it as a fracture, a hairline fracture, but I think it's more ligaments. And unless you give them time off and guard them 2 to 3 weeks, depending on its severity, doing it with something like odds on, that will not get better. Then bring the dog back up the straight for a straight run and see if it's running straight, if it applies to any of the rules we've looked at, this straight running. Very important injury, and if you look at the steward's reports, not a week goes by without I find that injury at some track or another, particularly the gardens. This is an injury that you would expect to find in young dogs, mid-shaft radius. There's a little sort of blood vessel where it goes through the bone in the mid part of that radius on the forearm. And often they'll get a remodelling, a lifting of the periosteum. The periosteum's the covering to the bone, and you'll be regular with shin soreness down here. The same sort of shin soreness can occur on that mid-shaft radius of your younger dogs coming through, maidens to lower class 1 win dogs. So always feel for that lump. If it's not painful, not a problem. If you're getting a reaction, particularly on the near foreleg, then it is very significant, and the dog obviously needs time off. A lot of these bony injuries I obviously treat locally, but you need to supplement quite often with a calcium. And your normal calcium you may feed in a dietary sense is certainly not satisfactory. They don't absorb normal calcium powder once the growth plates are closed, and you shouldn't be racing with open growth plates. So if you've got this sort of problem, you need to get a special type of calcium. I use osteoapatite with boron. It's a calcium that women take after childbirth, and the theory of it is the heavy metal boron is absorbed easily, and the tablet is made such that the calcium is bound to boron. So you'll get a very good result with absorption of calcium if you use that sort of trick. To waste of time giving a lot of your calcium powders after your growth plates are closed. So for these things that need special levels of calcium to increase your healing rate, without that, say that hairline fracture there, the dog will suck calcium out of its stopper bone or some adjacent bone to heal that. So you need to supplement with a really bioavailable source of calcium. Of course, you're all fairly familiar with metacarpal periosteal remodelling, shin soreness. We used to see it a lot on grass tracks, and classically on grass tracks, the grass looks spongy, but underneath it's rock hard, and that's why we got a lot of injuries with the metacarpal on grass tracks. And it was always the left metacarpal 5, the outside metacarpal, but now we're running on loam tracks. The centre 2 metacarpals are the more common bones that are being injured. So that's an important thing to be aware of. Again, maidens, young dogs, break-ins, put your thumb on that metacarpal. Some of them are lame straight after a run. Some can have an acute fracture, some can just be sore. But all of these bone injuries, you've got to let them cool down for at least 6 hours, and then put your thumb on that metacarpal area, looking for reaction. And that needs a multiplicity of treatments depending on the severity of it. We saw the initial image about the extension or hyperextension of the wrist joint here, and always feel for any thickening or pain in that stopper ligaments, the ligaments under that accessory carpal bone. Another one that I see fairly commonly, and a lot of trainers don't understand or don't know their dog's got it, is the medial tibial ridge. This is inside the leg. Track leg happens down here. But up the top there, at times they will get, again, a lifting of the periosteum, a lifting of the covering to the bone, and it will start to slowly calcify. So you'll have a dog that doesn't jump, doesn't corner, but runs not too bad up the straight. So cup your fingers, put them inside that tibia, you'll feel a sharp ridge. Compare one side to the other, squeeze a bit firmer. If it's painful, that'll probably be a month before that's right. It's a remodelling sort of stress fracture that does take longer to heal. But always check for your medial tibial ridge. Hock ligaments. When we're looking at the back leg, you put the foot in the hand and then you flex the leg up as firmly as you can. You do that for several reasons. Sometimes if there is some soreness with the hock ligaments or the hock bones, the dog will react. Go to the other side, see if it's a sook. If it doesn't react on the other side, then you've got a problem. But what sort of problem do you have? It can be the hock itself, or as we'll see in a moment, it can be related to the fibula bone, which is the fine, thin bone here. While we're going down the dog, we always need to look at the L7 lumbar vertebral process. This is an injury that often occurs during rearing, and you get the dog, and it's weak there, and it doesn't jump very well. It's the spinous processes are up the top of these vertebrae, and the seventh one is where a lot of attachment comes from. So it tends to pull away, and that seventh process often decalcifies. Some dogs, you can actually put your thumb on it and push it up to 8 mil side to side, nearly half an inch of flexibility. That dog, while ever that's like that, won't go very well. So always feel for that L7, that seventh lumbar process. So sort of treatment for that is usually needling a cortisone, a spell, and follow up with some heat. That's very important to try and get some strength in that lower back. That's significant. When we flex the hock, we could get some problem with the hock, otherwise the fibula. 3 parts of the fibula can be affected. One, right up the top there, if you press just as below that little ridge, sometimes you'll get periosteal changes there. You can just go to the next click. So within the hamstring itself, you've got to feel fairly deeply, but sometimes you get stress there, and probably the most common one is the lower one there, which I call the saphenous fibula, which is just that part of the fibula bone where the vein crosses over. You'll see that vein quite easily on the side of the leg, and that's a common area you'll find a little lump of bone forming. So when you flex that hock, work out if you've got a fibula problem or if you've actually got a primary hock problem. With the tibia, you won't get much reaction when you flex that hock. Next page. Just doing a couple of those again from underneath. Superficial pectoral is something you can find soreness. It's a little muscle runs from the breastbone across to the inside of the shoulder. Shame that image isn't as clear as what it was on my computer, but at least we've turned our dog upside down to look at a few things now. So moving along, the deep pectoral. I think those sort of injuries with deep pectorals are often over-exaggerated. It doesn't cause that much problem for the dog galloping unless you've got an actual tear or defect in the deep pectoral. We spoke about the rectus abdominis earlier, and that's just another view of it. And another one that's very significant and no one ever checks for is the pectineus. Hasn't got a common name. It's a funny little muscle about the size and shape of your thumb that occurs right up in the groin, just in front of the main femoral artery there. Get behind your dog, cup your fingers either side and feel both of those pectineus. Sometimes they tear from the attachment of the pectineus. The adductor muscle is the one that I find reasonably commonly as a deep groin tear. An adductor deep groin tear on the rail side, dog will paddle with its right hind leg and vice versa. So be aware of that just by watching the dog running. Gracilis is the classical muscle that we have as a drop back muscle. It's not too bad when it tears from the bottom. When it tears from the top, I see very few of those returning to racing. Moving along there, injuries associated with have predictable patterns of running. For example, if you have a deep groin tear, I expect the dog won't jump very well. It will ease at the first turn or run wide. It'll gallop and hold position up the back straight. It'll go wide on the home turn and then tend to tail off a bit as the injured muscle fatigues. So there's ways of watching the dog running relating to particular injuries, and it's a fairly involved thing, a lot longer than we have for our associated time here today to go through all that. But there, all those injury patterns do exist. Just as a final slide to summarise a few things, it is important to acquire skills to observe and analyse your greyhound's performance. And going back, those skills start from watching your dog standing, watching it walk, looking at your sectional time. Acquire skills to physically check your greyhound after every run. So often I'm told the dog ran, really good time, and it wouldn't do that if it was injured, but often the dog has injured itself when it did do that. so should be checked after every run. It's good to build an association with a greyhound vet. His skills are probably better than yours, and you will continue to learn. And work with your vet. Don't play games. Provide the essential history to your vet. Hundreds and hundreds of times over the years, people bring a dog to me, they've worked out what's wrong with it, and they're just testing me to see if I find it. That's not the easiest way to get a good working relationship with your vet. It's important. Your medical practitioner, he just doesn't come in and not ask you questions. History taking is a very important thing. And when you go to the doctor, you tell the doctor half a dozen things that's happened to you and what might be wrong. When I watch a dog run, my history only lasts for 23 or 30 seconds on the track. That's why I watch every single race, because I can learn and know what is likely to happen to that dog and what injury it may have on the basis of that little 30-second history I've just taken. So there are few greyhound vets and even fewer willing to learn the essential skills of greyhound sports medicine. And becoming a dinosaur, and when all these older guys have moved on, there won't be too many younger people to replace us, because all those physical examination skills have been lost. If overall track time is slow, consider having a blood count, fecal test and urine test to identify any internal problems. So many dogs are thought not to be race ready and retired too early, whereas they haven't been properly examined, properly looked at internally. Give them every chance, and a working relationship with your vet is very important to give them that sort of chance. So I hope I've given you an overview there of systems you can do very simply to analyse your dog, its performance, and get some inquiring questions as to what might be some of those more unusual injuries that are so significant to performance.
Thanks, Rob. John, I just missed the name of that calcium supplement you recommended. Just the name of it, please.
Yes, you might have to go to a vet to get that particular one. It's a prescribed medication. It's called osteoapatite, A-P-P-A-T-I-T-E, osteoapatite with boron. That's the key. The boron, B-O-R-O-N, is the heavy metal, and that absorbs very well to assist these sort of remodelling bones in greyhound closed growth plates. There are similar products that'll work much better than probably your common DCP powder at this stage.
Thank you very much.
Tablet form, yes.
Thanks very much, John.
Thanking you. I usually give one morning and night for a week, and one a day. We're in time for lunch.
On my question, Johnny, sorry, mate.
Just a quick question, John. On track injuries and stuff like that, there's statistics that with the tracks and things like that to try and pick up what injuries have been caused at each track. Or sometimes you see a dog break a hop and you think was it the track, was it the dog, was the dog injured beforehand, or was it going to happen anyway? Is there any way like that sort of impact on those tracks?
The question is about racetracks individually, about what record is being kept on how the greyhounds are injured on the particular racetrack.
Yes, that's one of the very important things that Greyhound Racing New South Wales have monitored and done quite some time. When Tony O'Mara was with us, we'd review those injury stats on a monthly basis. With our interim sort of governance now, that hasn't happened. But up until then, our hock injury rates at Gardens and Maitland was down 50%. And the track maintenance is just such an acute thing. You've got to look at your weather forecast, the amount of rain anticipated, the wind evaporation, and try and balance everything to get that deep watering in relative to the weather that's coming in 3 days' time. And I think they've done quite a good job. I mean, there'll still be dogs that will get injured, but that information is there and can be properly retrospectively analysed a bit more. But most of the injury that I see is from racetrack interference now.
Does it have any stages, like there'll be a week where it happens a lot, where it's other times not?
Yeah, well certainly you're probably referring to refurbishment of tracks. Yeah, it's always a bit of a risk period because tracks have to settle in, no matter how well they're rolled and watered and prepared after resanding. There is some shifting, and that's where it's important to get the moisture into them for some days prior. But yeah, it's a reality of life. The tracks have to be turned, and if we turn them more often, you can delay the total rebuild and sand of new tracks like that. So.
Do you have any say in the track? If you see a track that doesn't look quite up to scratch for a meeting, you say anything?
I've got a good working relationship with Bill Wilson. I think he's been an asset to the greyhound industry. What he's done has really assisted that track surface and the importance of the deep watering. I think it has improved relative to our track injury rates having reduced so much. And yes, in conjunction with stewards, and some stewards are a bit more tuned in than others, I have abandoned races due to my concerns of the track, and it's a no-win situation. There'll be a lot of people that won't agree with you, but a decision has to be made, and that decision has been made quite a number of times.
Ladies and gentlemen, we must now break for lunch. Of course, John is open to other questions through the day, and again, if you'd like to contact us, we can get them forwarded on to him for an answer. Ladies and gentlemen, please thank John Newell.